Hello, my name is Dr. Roman Dvorak, and I'm here today to present to you the results of our exploratory study of a new combination of two drugs, tesofensine and metoprolol, in treatment of patients with Prader-Willi syndrome. The drug is being developed by a Danish biotech company called Saniona, which is an expert in the area of ion channels. So Tesomet is a combination drug, which is a combination of tesofensine, which is a monoamine reuptake inhibitor, and metoprolol, which is a beta blocker. You can see on the figure here that tesofensine indeed inhibits the reuptake of these three neurotransmitters: serotonin, norepinephrine, and dopamine. And as such, it has shown various positive effects in animal models, such as reduction in food intake, weight loss, improvement in glycemic parameters, and in a model of a liver disease, improvement in liver function. Indeed, if you look here, the drug not only affects the center for appetite, thus influencing appetite and satiety, but also the reward centers in the brain, thus reducing craving for food. Also, one of the effects of the drug is a small increase in sympathetic drive, which then causes a small elevation in heart rate and blood pressure. And that's why, to counteract these effects, we have added the beta blocker metoprolol to the drug to form this fixed combination. The drug tesofensine has actually been around for quite a while, more than 10 years, and it has been tested in more than 1,600 patients for various indications such as Parkinson's disease, Alzheimer's disease, and obesity. The drug has been very well tolerated and is quite safe. Here you can see results of a study in more than 200 obese patients where tesofensine induced a very significant weight loss over 24 weeks of treatment. Indeed, if you look at the bottom at the green and blue arms, there was more than 10% weight loss at 6 months. Also, very importantly, the drug had a positive effect on appetite, as you can see here, in dose-dependent fashion. So now, how does all of that come together for Prader-Willi syndrome? In Prader-Willi, these patients exhibit ravenous appetite, constant seeking for food, and similar behaviors. And not only these behaviors have a deleterious health effects, because they lead to development of obesity with consequences such as type 2 diabetes, cardiovascular disease, and premature death, but also they put tremendous strain on their families and caregivers. We believe that due to its unique mechanism of action, tesofensine can counteract many of these effects and bring very significant benefits to patients with Prader-Willi syndrome. So we conducted a phase 2 study to test it. This was a double-blind, randomized, placebo-controlled study. It lasted for 12 weeks. We used the dose of tesofensine of 0.5 milligrams and dose of metoprolol of 50 milligrams. The key endpoints of the study were hyperphagia score, body weight, waist circumference, lipid and glycemic parameters, pharmacokinetics, and of course, safety. Here you can see the disposition of patients as they went through the study. We screened 9 patients for the trial, and 6 of them were randomized into the active group and 3 of them into the placebo. And here you can see over time how the patient numbers were changing, and eventually we completed the study with 2 patients on the active drug and 2 patients on placebo. Here are the demographic information about patients participating in the trial. You can see that we had more females than males in about 2-to-1 ratio. Their age was in the mid-20s. They were quite large. The average body weight was between 94 to 130 kilos in these 2 arms. Importantly, the hyperphagia score at entry was between 10 and 12 in these 2 groups respectively, and that's because we didn't have any particular cutoff for patients at entry. And here is one of our key results. This is the effects of the Tesomet combination of hyperphagia score over time. And you can see in the red, which is the active group, that from the average of about 10 at the beginning, this went over time to 0. while in a placebo group in blue, after some initial drop, the values return over time almost back to the baseline. Here are the results on body weight. The drug induced a slow and gradual reduction in body weight over time, which you can see very quickly separated from the placebo group in a blue. Very important for any new drug is its safety profile. We are very pleased to see no serious adverse events in the study. All patients in the trial experienced adverse events over its duration. Quite a few of them were possibly related to the study drug in both of these arms. Importantly, we saw some adverse events which looked like exacerbation of pre-existing conditions in a CNS or psychological psychiatric area. And these seem to be exacerbated by the study drug. We saw no effects on cardiovascular parameters such as heart rate and blood pressure, and also no deleterious effects on any safety laboratory parameters. Here is an important finding in this study where, when we looked at pharmacokinetics, the levels of the drug in the blood, we saw quite an increase versus what we expected. In a figure on the bottom, you can see what we saw in a study in regular obese patients. So there in the middle in blue, you can see the drug concentration of 0.5 milligram dose of tesofensine in obese patients. And here the concentrations were about 8 to 10 nanograms per milliliter. If you look at the top, you see that patients in this study with Prader-Willi syndrome had concentrations greater than 20 nanograms per milliliter, and actually 2 of the patients had concentrations greater than 30. So 2 to 4 times the concentration as we expected. In conclusion, we saw a very encouraging efficacy signal in this trial. We also observed, as I said earlier, significantly higher plasma concentrations of the drug in the blood, which we believe were the reasons behind the adverse events. We are currently starting a trial which is very similar to this one in Prader-Willi patients 12 to 18 years old, so adolescents, where we have significantly reduced the dose from 0.5 milligrams to 0.125 milligrams. And also we have put in place regular evaluations by psychiatrists. And we hope that if this trial confirms the benefits we saw in this initial study, that we'd be able to proceed to the next phase of development of this drug and initiate a global phase 3 in 2019. Thank you very much for your attention.